Welcome. This is our maybe 100th, I want to say, pupil personnel. It's a little bit of a stretch in terms of number at the North Shore North Shore Child and Family Guidance Center. I welcome all of my fantastic panelists. I welcome all of our participants. Happy rainy Monday morning, but we bring the sunshine, not the weather. So hope you're all feeling energized after a weekend. So before we jump right into this, why don't we go and invite our panelists on screen to introduce themselves. And why don't you talk a little bit about how long you've been here at the Guidance Center as well, and what programs you oversee. Before you do that, I'm just going to quickly introduce myself. My name is Kathy Rivera. I am actually the newbie of the group. I am the new Executive Director and CEO of North Shore Child and Family Guidance Center. We're also known as the Guidance Center for short to some of you. And I have been here for now going on 4 months, and my pronouns are she and her. So I'm going to look at my screen and randomly call on each of you. Nellie, why don't you unmute yourself and introduce yourself?
Morning, everyone. I am Nellie Taylor Warthruss, and I'm the director of North Shore Child and Family Guidance Center, the Leeds Place, located at 999 Brush Hollow Road in Westbury. And the Leeds Place is our adolescents chemical dependency treatment program for adolescents and their families. And it also includes an on-site mental health clinic as well. At the Leeds Place, many of you know that we provide community outreach services, specifically in the Westbury School District, the middle and the high school. We provide on-site prevention, substance abuse prevention, education, and awareness. We also provide outreach services to pregnant and parenting teens through our Good Beginnings for Babies program. And we also have our grandparent program for grandparents that are caregivers of their grandchildren because of some unforeseen circumstances. So I welcome everybody, and I'm just happy that I can join with you all once again. We've been doing this for many, many years, and I have been with the agency for 32 years.
Thanks, Nellie. Okay, Alyssa, you are up.
Good morning, everybody. My name is Alyssa Smilewitz. I am the Director of Triage, Emergency Services, and the Suicide Prevention Project. And what we do is we work with high-risk adolescents, young adults, and children that are at risk of suicidal thoughts, high-risk behaviors, depression and anxiety in an outpatient mental health setting. We provide intensive services to help these children modulate their mood, getting them in a better place, and being able to continue their lives in a healthy way. I have been with the agency since 2001 after 9/11. I just want to say that 9/11 was a trauma for us. This pandemic is also a trauma that we're all dealing with right now. Thank you.
Thank you, Alyssa. And thank you for the reminder. You're absolutely right. One of the things we want to make sure is that everyone who is participating today understands we are all in this together. As I've learned, we are a family that treats families. Sue, you are up.
Good morning, everyone. My name is Dr. Sue Cohen. I am the Director of Early Childhood and Psychological Services at our Right from the Start office in Manhasset, located on the North Service Road in Manhasset. This is the location where we work with our youngest children from ages 0 through 9. We provide individual, family, group therapy, as well as psychiatric evaluations and medication management for our clients. We also take part in the maternal mental health program in this office, as well as the Roslyn office. And we also have a grandparents group in this office as well for grandparents who aren't raising their grandchildren, but they have grandchildren who are on the autism spectrum, and they are, concerned and caring for their grandchildren. It's a support group that's very valuable to them. We also provide psychological services, psychological testing for children throughout the agency. And I've been here, it's coming up on 30 years.
Thank you, Sue. A lot of talent here. And last but not least, Bruce, you are up.
Okay, thank you. I'm Bruce Kaufstein. I'm the Director of Clinical Services. So I kind of oversee the mental health programs at all three branches. I sit in on all dispositions where new cases are presented each week and assignments are made. I do a lot of troubleshooting. I get calls from some of you or many of you about particular clients that you would like to get some assistance with or having some kind of difficulty with. And I also coordinate or run the Wilderness Respite Program that we started over 25 years ago, where we do Saturday all-day respite trips for at-risk adolescents, hiking out at Kaufstein State Park and up at Harriman State Park. I've been here for 38 years, and I got to know many of you. Some of you, I think, were interns of mine or of the agency over the years. And, I certainly have been at all the pupil personnel meetings during my tenure. And I also want to inform you that it's been a privilege working here and knowing everybody, but this will be my last pupil personnel meeting as I'm retiring at the end of this year. And, so again, thank you all for participating and for the years of cooperation and participation and collaboration that I think we're all very proud of. Thank you.
Thank you, Bruce. You're not everybody's replaceable, and this is a significant loss for the Guidance Center, but we thank you for your years of service, and we were just really lucky to have you for all that time. So thank you, Bruce. The only thing I'd like to add, about who we are, because I think you've heard a lot from our talented team. The Guidance Center, North Shore Child and Family Guidance Center is our full name, is often referred to as the Guidance Center. We serve all of Nassau County. So as I see a lot of these participant names, I know you represent so many of the school districts. There's 56 in total, and happy to see all that representation. If you're new to us, just know that we are the lead provider in children's mental health for the past 70 years. 2023 will be our 70th year anniversary. Our mission is to restore and strengthen the emotional well-being in children and their families, ages 0 to 24. You heard from our group. We have 3 locations: Manhasset, Westbury, Roslyn. And just a reminder about our overview, we have outpatient services. We do it all: individual, group, and family. And just like this pandemic, we have morphed into continuing to do it in person, but also virtual services. We have community-based services. We have where we bring the services to the children and families who often struggle or may not be ready to come to us. We will make sure we bring it to them. The drug and alcohol, some specialty programs. We have a Latina girls program, suicide prevention, which Alyssa will go to, her emergency triage, which she referenced. We understand these high-risk cases need immediate attention. So we outreach within 24 to 48 hours. We do not wait. With the maternal depression program, the grandparents program that you've heard about, and the respite program. What's most important for those of you who are listening today is that we truly, literally treat the family ecosystem. We don't just treat the child. So understand that we turn no one away for their inability to pay. We don't care what your zip code is. We don't care what your bank account is. We don't care what you do or don't have. You will get the same quality care when you come to the Guidance Center. And we believe in equity and equanimity as far as it relates to access. So you know, as I mentioned, we are going to quickly go into what we've been seeing as the Guidance Center as we work with so many communities, what our children are going through, what our families are going through. Let's just be clear, the pandemic didn't cause this, it enhanced what was already going on. As a 70-year organization, we have seen mental health transition throughout the years, and we see that needs have changed. We build our services based on those needs. We don't come to communities and say, this is what we think you need. We hear what you need and we make sure that we deliver it. So after we do our presentation, we're going to access the Q&A feature, again, at the bottom of your screen, and we're going to answer any questions that you may have. If you don't have any questions, we encourage you to also chat in the Q&A and tell us what you're seeing. The return to in-person learning happened several weeks ago, and we are getting a ton of calls and a ton of information from the community about what they're seeing, what they're grappling with. The schools are saying, you know, we're here to teach and the students are here to learn, but we're seeing some other things that we just can't address. We need some help. So we want to hear that from you. Thank you. I already see that, you know, the anxiety and the socially disconnected students. We got you. We're going to cover it. We're going to chat some more about it. As a reminder for those of you who might have just joined, this is recorded. It will be saved. At the end of this all, we will be providing our direct number and we will provide you with the link to our website and more specifically, the link that can bring you to this recorded session. So we encourage you to look it over. We encourage you to make sure that you access it and please, more importantly, share it. Couple of things I want to say, and then I'd love to turn over the mic to Alyssa. But before I do that, Regina's trying to get in. If you can let her in, that would be great. She said she's in the waiting room. Technology today, you got to love it and you have to hate it at the same time. What I want to share with the group is what the Guidance Center is in line with what the Office of Mental Health of New York State is seeing nationwide. You know, this pandemic enhanced the great need for mental health services for communities. It's not just a Nassau thing. It's not just a school district thing. It is global and worldwide. But here's some statistics, right? Some data that I thought was very important to share with this group. In 2020, the Office of Mental Health has reported we have seen 44,834 suicides, not attempts, suicides, actual death caused by suicide. That is a real number that just gives me chills, even as I always share it. The number one is a big number when you think about anyone taking their life. 44,834 is even more astronomical. Some more data is that what has been seen also is that we've seen an increase by about 30% of ER visits are specifically with adolescents with mental health needs. We've also been seeing an increase in girls engaging in suicide by 51%, 51%. Based on this data, what the Office of Mental Health knows and predicts is that a projected 40% of Americans, whether they had a mental health history or not, will be dealing with the mental health side effects from this pandemic. And what's more important is to note that the symptoms that they're going to see or that we have been seeing are going to be projected as being anxiety, depression, post-traumatic stress disorder, also known as PTSD. So the reason we thought that it was important to focus on this is that what best practices and interventions out there, what we know is that when you apply them, we can save lives. You can save a life. Seeing something, saying something can save a life. So I'd like to have Alyssa, talk a little bit about that. But we finally have Regina that was able to join us. Yay. It's okay, Regina.
I'm sorry about that. That was tough, but I'm so happy to be here. Good morning, everyone.
Yeah, and Regina, if you could just take 2 seconds, introduce yourselves, just tell us a little bit about your title, how long you've been at the Guidance Center, and what you oversee, and then we'll switch it over to Alyssa.
Okay, good morning. I've been with the organization for 32 years. My title is Chief Operating Officer, and I'm honored to be part of a group of people that work very hard to service the community. I oversee the clinical services, the director of clinical, director of mental health, director of triage, and outpatient and high-end services. So we work very closely with the school systems. I always say that we are your partners in taking care of our children and families.
Thank you, Regina. So Alyssa, you have a lot of, simple programming under you, emergency triage, suicide prevention, the list goes on and on. So, we have a lot of folks who are participating that represents a lot of different roles within the school system, elementary, middle school, and high school. So if you can talk a little bit about what we've been seeing, what you've been treating, what the trends are, what we predict, and obviously, where folks can find help.
Yeah, thank you, Kathy. So I think we all need to be cognizant of the fact that we've been in this pandemic for 18 months. This is 18 months of many children, adolescents, and young adults that have been isolated in their homes. And the homes could be very unstable. We don't know. There's domestic abuse, there's substance abuse in some in the homes, there's financial insecurity that's going on with a lot of families. And we also have to recognize that children have not had that ability to escape, go to school. So we have to be cognizant of that fact. The main thing is that what we're seeing at the Guidance Center, we've had a 50% increase in the emergency triage services, urgent care and ER services, pediatricians that are doing the depression scale, and also the schools. The schools are also calling us. And what we're seeing is a lot of depression, anxiety, suicidal ideation, and some attempts. We've had some children coming out of the hospital due to suicide attempts. And what we're seeing more so is younger children that are having suicide attempts. We've had quite an influx of 11 to 13-year-olds, which is remarkable. We usually get the 14, 15, 16 years old because they're in high school and they're looking to college and they're overwhelmed and stressed out. But these children are dealing with a lot of situations in the home and also returning back to school. It is a difficult transition for these children. We have to be cognizant of that. Many of these children are struggling with the feeling of overwhelmed, anxiety, stress, academic stress because they've been doing virtual, fear that they're not going to be able to tolerate or handle the workload, or even going into social situations, or they're feeling uncomfortable. So what I'd like to do now is, now that I've talked about some of the issues we're having, I could tell you that at the Guidance Center, what we do is we do individual, family, and we also have parent groups. And the parent groups are there to help parents, educate them on how they can support their children during their distress, learning how to calm them down, learning the coping skills that we're teaching the children in our groups and individual. So the importance of the family as a whole needs to work together to help support these children, and we're very, very aware of that. We also provide psychiatric services when needed. So, and we do this quickly. If we get an urgent in, between 24 to 48 hours, they have an intake and we start the process of outpatient. So I want to talk about now some of the things that you might be seeing with children in the schools. And they're a little bit different than what you would see at home, but I'm going to tell you what what we have. The first one is withdrawing from friends and family. So if they're withdrawing from their parents, they're withdrawing from friends. If they're socially isolating, that's a red flag. Also doing risky or self-destructive things. That could be self-harm, that could be doing high-risk behaviors, sleeping more than usual. If your children are sleeping after they get home from school for hours and hours and hours, that's a red flag. That's a sign of depression. Increased use of drugs or alcohol, especially when we're dealing with 14, well, actually we have some 12-year-olds that we're struggling with substance abuse too. So that's another red flag. Giving away possessions. Children that are giving, or young adults or adolescents giving away their possessions, that's a concern. And the biggest thing that we have seen in the guidance center is children posting on social media that they don't want to live anymore, that what's the use? Some of them have actually said that they were considering suicide. So that's very concerning. And also even aggression, especially in younger children that can't verbalize how they feel. Sometimes they act out behaviorally. So you might have children in elementary that are aggressive, or they're irritable. That could be a sign of depression, anxiety also. So we have to be aware of those things. So those are some of the signs. And what we do at the Guidance Center is we provide the care that is needed. We also have our new project, the Douglas Ed Feldman Suicide Prevention Project, has been very helpful. They have allowed us to increase the triage department. We've also been able to do more outreach in regards to families in our communities. We have a brochure that everybody here should be getting. It's on our website also, and it lists all the red flags and the statistics. So those are some of the things that we're doing. The CDC has said that, in order to help prevent suicide, it can be prevented with young people, teaching them coping skills, and increasing the signs of suicide risk, limiting the lethal means, and that means also medications in the home if they're at high risk. So, many times what we'll do when we have a child come in that's expressing suicidality, the triage clinicians will do a safety plan, and the safety plan is to help the family feel more in control and be able to keep the child safe while we do our treatment process. And this is a way for the child to feel supported and feel like they are being monitored. It actually helps them feel better. And also giving the child the voice to be able to express it to the family, because sometimes what children do is they're afraid to say anything. They don't want to burden their family. So it's very important that when we work with the child, that the child and the family know what's going on so they can support and help each other.
Right. And I just want to say, Alyssa, thank you so much. One of the important things, and, we just actually did a presentation for Schreiber for transitioning ninth graders, incoming freshmen. And, we talked a lot to the caregivers, right? Credible messengers are really key. Sometimes your students, right, are more crucial in intervening than the adults, and educating them and helping them support their peers are really key. I think that, sometimes as staff and personnel in school, we forget that there's some questions we're allowed to ask, and it's okay. Asking, did you get enough sleep last night, right? As opposed to, something more, detailed, I think is also a good indicator. Food and mood is tremendously huge too, right? So someone not eating or someone remaining really irritable because of a lack of nutrition because of the depression, right, is something that you should ask as well. If you're seeing some behavioral issues, there's nothing wrong with asking some of those key questions. Did you get some good sleep last night? Are you tired? When was the last time you got some good sleep? Did you eat today? Are you hungry? right? Those kinds of things, can really be contributing factors to some of the behavioral health issues that we're seeing, mental health issues, and they're tremendously easy to fix, if you will, right? Or easy to address. But if you don't ask that question, you're not going to know. I know that also for parents, we often educate them and encourage them to ask children, are you feeling this way? Do you want help? Do you think I can help you with that? If not, can I ask? Or can I find a way to get you some help? Sometimes we get scared to ask that as adults, right? We get nervous. We worry that we're introducing something to a child, but honestly, if someone's feeling those feelings anyway, there's sometimes this level of relief when you ask them something and that they now are getting permission to talk about something that they might have been holding in. I never like to use the word normalize. I think that the more and more we can naturalize this, we can eliminate the stigma with regards to mental health. So I don't know if there's anything else the panelists want to contribute, because we can go into the Q&A piece. But if there's anything else that any of my panelists, because I know you've been seeing a lot as well, want to contribute, please feel free to do so.
I just wanted to add, in addition to what we are seeing in the mental health, but we are seeing more in our adolescents chemical dependency treatment program, more co-occurrent disorders. I mean, these adolescents that are not only using or experimenting with substances, pretty much marijuana and alcohol, but they also have an underlying mental health diagnosis or an underlying mental health illness that have not been diagnosed. So we are doing more and more. I think our adolescent population in treatment now, it's probably about 80, almost 85% of the adolescents that we are seeing between the ages of 12 and 21 years old have a co-occurrent disorder, and it seems to continue to exacerbate, especially with the COVID-19 and the lack of coping skills, the lack of activity, lack of involvement. Kids are really, really suffering. It's one thing to have experimented with substance, but you also self-medicating with illicit substances. So that is a key area that we are doing more and more assessment, a thorough assessment, a good differential to rule out. And we are finding, and the good thing about our adolescent chemical dependency treatment program, we do the work simultaneously. It's not like we had to refer them out, but we treat the substance use and the mental health as one illness, as a co-occurrent disorder. So I just wanted to add that. And yes, referrals, we work very, very close. I know the Westbury School District is on, and we have a fast track referral with Westbury School District, and we've been partnering with them for many, many years, and the numbers continue to come in. So thank you.
I would just like to also say that what we would like to do is, you are going, I saw somebody asked about how to refer, and we're going to give you all that information and give you the ability to do the referral. One of the things that, we can work on a fast track with school districts, just like we do at Westbury. It will be something that, maybe we can do in order to get these children seen sooner rather than later. But I also want to talk about the fact that we're getting a lot of school refusal. And I just wanted to bring that up because I really think, it could be partly behavioral, but I think it's anxiety related. I think that a lot of children have been doing the virtual, and the thought of going into a school and seeing all those children is very overwhelming. I know that a lot of the triage clinicians have been working with some of the social workers in the schools, and they have been very, very receptive to working with us together and getting these children back into the classroom. And I just want to say thank you. I think we do need to work together to get these children back on track and help them in regards to feeling like they're in control, and lessen their anxiety and lessen their thoughts of of suicide, which it relates to not feeling safe, not feeling comfortable. So, you know, there's a lot of work that we could do together to help that.
And if I could just add, you know, I feel for the school personnel, because this is, I consider, a transition period, just like it is for the workers. So everyone, all of us have been traumatized, and there's a transition of going back to what is still there, a virus, and that it can be deadly to family members still. And let's not forget that. So children are walking in, all children, not just children who have had a history of psychiatric illness. It's all children are very anxious. And also children are feeling like they lost a year of education. So they're a year behind. So if I could recommend anything, it's just allowing in your schools to have a time to just talk. And just talk about how hard this is to transition. It's just something I wanted to share.
Thank you, Regina. And, you know, just also being cognizant of the communities that we serve, and sometimes the language barriers of not only students, but sometimes the families. You know, we have bilingual, Spanish speaking, bilingual, bicultural. Oh, I'm on mute. I didn't even realize that. Okay, I just wanted to say, you know, thank you, Regina. I also wanted to acknowledge the communities that we serve and the different needs, language needs more specifically of sometimes the students, but also their families, right? You know, the families are a crucial part of the treatment. Whether it be high risk or you know, other issues that may arise, any kind of trauma. You know, we work with a lot of families and young people who are really suffering from things like divorce, right? Separation. We're seeing the trauma in those children, especially the munchkins, right? The little guys. So, you know, we do have bilingual staff, bilingual, bicultural, Spanish speaking, even in our drug and alcohol, we have Creole speaking folks. So just want to make sure that, you know, everyone understands that we will meet the needs of the families, not only clinically, but also just breaking down some of those other barriers. So just last chance, Sue, did you want to say something?
Yes, you bring up the divorce situations. Our young children are experiencing all of the above, particularly involvement in divorce, custody issues. They're being put in the middle and tossed back and forth between warring parents. We've seen younger and younger children coming in with suicidal ideation. Some children, you know, unfortunately, we have to send to the hospital for safety assessments. We try not to. It's not our, you know, preference, but it has happened. We do have impulsive children who make suicidal gestures. So, you know, anxiety, depression, all of the above applies to the younger population as well, and we're seeing more and more of it.
Thank you, Sue.
I would like to underscore one thing. That was, I think, the first thing that Kathy spoke about, which is you know, communication with students. And I was actually thinking, really, who am I talking to? Am I talking to parents? If I was talking to parents, I would say, if your child is withdrawing and showing symptoms, you know, and behavioral and emotional symptoms that have changed, you know, don't allow that withdrawal to continue. Please, you know, engage in dialogue, even if the child is walking away, even if the child doesn't want it. You know, you might say the right thing, which would open up the floodgates for a child to say, yes, thank you. You know, this is what I'm struggling with, and I didn't want to burden you with it, or I was too embarrassed or felt humiliated. I shouldn't be feeling this way or thinking these ways. So that's what I would say to parents. But then again, you are unfortunately surrogate parents, just as we are in some kind of manner. You know, you have them all day, and you know, so when teachers are reporting, or you're recognizing that students are withdrawing, or the behavior has changed, you know, the more you can do to engage that child and raise questions and indicate that you have some concerns or you're seeing a change, you know, communication is not going to hurt. It's not going to drive them further into their depression and isolation. That's been proven not the case. It shows on some level, I think they want to know that someone is recognizing that and is caring. So support groups, individual meetings with kids that you have relationships with, those are really, really important at this time.
Thank you, Bruce. Good point. Words matter, right? So even with bullying, we know that words hit harder than a punch, but words can also heal. And just letting someone whether they're ready to talk about it or not, that you're seeing something in them, you want to hear it, and that you're there to help can really make a difference. I always tell my adults, in my line of work, what you do and what you don't do can really determine a really significant outcome and can have long-lasting effects. And it really goes both ways. So really, really key. I'm going to actually share my screen as I promised. I hope everybody can see it. This is our direct line. So for some of you who are asking, how do we get in touch with you? This is our direct line right here. The link in blue is to our actual website. In the media section, you can look at this website, is actually where you will access this recorded webinar, as well as I mentioned the Schreiber School. We did a presentation for incoming freshmen. If any of you want to take a look at it and listen to some of the material that we shared, that actually the population were students and parents that participated in that. So we talked a lot about the expectations and how important these transitions are and how they can have a significant impact on emotional, psychological, physical, cognitive development, and really how that impacts, healthy minds, healthy kids, so if you have a healthy mind, the rest will follow, so to speak. So Maria, I think you've been monitoring some of the Q&A for us. I'm not sure. I don't see anything in there unless you see it on your end. If you can just, I think we have some stuff in the chat.
There's mostly things in the chat, no Q&A.
Okay. So still time, nothing wasted. I'm happy to look through that. So morning, everyone. Thank you for joining us. Someone talked about, if we could talk a little bit about anxiety and socially disconnected students. Not talk about it, but I think that that's what they're seeing. So I think we touched a little bit upon that. Someone did ask about how we refer. I don't see anything else. Let me just give it a second. Again, the Q&A feature on the bottom is what you can use to ask any questions and or share with us, because we want to hear from you in your school districts. What is it that you're seeing? What is it that you are finding has been a struggle, especially as the young people return to in-person learning?
Kathy, I also just want to say that for the social workers and the guidance counselors and the psychologists at the schools, the brochure on the Douglas S. Feldman suicide prevention brochure is there, and you can give that to parents that you are very concerned about. It gives them the list of the risk factors. It gives them our contact information and what we do. It would be something that you can give to those parents that you're concerned about.
Thank you. Thank you as a reminder. That's really helpful.
If I could share, the panel that Kathy talked about, maybe that's something your school might want to think about. We always think about community interventions, and this is different. We've never had anything like this before. So maybe if you go back, your school districts go back and could brainstorm a little bit about what do you think you could get from a community agency like ours. I mean, there's, referrals that means you can refer those children that at most at risk, but we see everyone and we connect with families and communities. So maybe there's a way of us partnering with you through something like what Kathy talked about, the panel you did for Schreiber, I think, that may be something that could be helpful. And then you see a face to the phone call, and it's really about relationships and partnerships.
Thank you, Regina. Good point. I'm just going to stop sharing. And we can email this out to the registrants as well, all of that information on the screen, so you know how to connect with us. I think, Regina, you bring up a good point. It starts with education. It starts with having a forum to talk about it. Again, you know, the more and more we can naturalize the fact that forget about, you know, a mental health diagnosis. I think, as you know, in terms of, you know, child development, there's, you know, stress is a real thing. Every one of us goes through it. And so, you know, if a child is coping with a stressful time, like a pandemic, like going back to school, like transitioning, like a divorce, like bullying, like, you know, whatever, you know, having body images, what have you, they need help and they need support, call us. We are here. If you even just have a question and you don't know what to do, or you know of a friend, call us. We're happy to help. We are here to support the community. You know, it takes a village to raise a child, and you can't do it all by yourself sometimes, even with the staff of how many. So you need to leverage the support of your community resources. So we do ask that you remember that and you reach out to us. I don't see any other questions or information in the chat. So I will give it maybe another minute, and if not, then we will sign off. As I mentioned, it will be recorded. I do want to thank everyone who participated today, not only just my panelists, but the participants. I know that it is never easy on a Monday morning, and I know virtual is always tough. I think everybody, I can attest to this without knowing you. Zoom fatigue is real. I think it's going to end up as a real diagnosis in the future. So, you know, we will be treating that. But I do want to thank each and every one of my panelists. You know, you are the talented team of this organization, and we are very lucky to have all of you. And we do this every year. So Pupil personnel, while new to me, is not new to us as an organization. We enjoy partnering, and we thank you. So I don't see anything else. All right, well, you have some time to yourself. Thank you. Oh, thank you so much. Thank you, Gus. Appreciate you saying that. All right, well, everyone, you have some time for your morning. Thank you, thank you. Have a wonderful day. Everybody stay safe, be well. And we're a phone call away or a click away. Take care, everyone. Bye-bye.